Hello and Assalamu alaikum. Ultrascan Diagnostics. So this is the CBCT of the patient that you had requested. The area of interest highlighted to us is the lower right wisdom region and its approximation to the inferior alveolar nerve. We will be talking about both the wisdom teeth and their approximation to the inferior alveolar nerve. Now this is the 3D rendering. We can see that the lower right wisdom is glossally carious, whereas the lower left wisdom is lingually tilted and is impacted as well. Moving to the panoramic view, on the panoramic view, we can see that the lower right wisdom tooth is root canal treated, is glossally carious, and the lower left wisdom tooth is non-root canal treated and has very slight caries associated. Moving to the transaxial view, on the transaxial view, which is approximately the proximal view of the tooth, we can see this is the transaxial view. I'm going to zoom in for our kind doctor. Now we're going from the mesial aspect. I'm going to slide very slowly to the distal aspect. So this is the tooth. We can see this is the glossally carious aspect of the wisdom tooth. Very little crown structure on the mesial side. Moving to the center of the tooth, we can see that it is root canal treated. There does not seem to be any periapical radiolucency associated with it. This is the distal root. The distal root is the root canal material is actually extruding out of the canal and through the apex and is in very close approximation to the inferior alveolar nerve. The root apex, however, is approximately 1 millimeter away from the nerve. So extraction needs to be done very carefully because both the roots are close together and the distal root apex is in very close approximation. It does not invade the inferior alveolar canal. It does not cause any compression of the canal, but it is in very close approximation. We see that there is good bone support on the buccal and the lingual and a very shallow lingual fossa. Moving to the lower left wisdom tooth, the lower left wisdom tooth is, as you can see, lingually tilted. This is the lingual aspect, this is the buccal aspect. Here we can see that the tooth is also very close approximation to the inferior alveolar nerve, approximately 1.2 millimeters. It does not cause any compression of the canal, so this tooth is still in a very better position. Now this is the distal aspect. The distal aspect is also very close to the canal. The roots seem to be very non-divergent, and the mesial root is also very close approximation. There seems to be an ankylosis of the wisdom tooth with the buccal cortical plate. So this is something that needs to be very well understood before attempting an extraction, and you can clearly see at 150 micrometers there is very little pedial space between the lower wisdom tooth and the lower left wisdom tooth and the buccal and lingual cortical plate. So we can see on the lingual cortical plate there is very nice pedial space, but on the buccal aspect the pedial space is absolutely negligible. There we go. It is very closely fused with the tooth, and extracting this tooth is going to be a significant challenge. There doesn't seem to be a radiolucency associated, but we do see an area where the trabecular bone shows a radiolucent area, but we don't see any major radiolucencies associated with the tooth. On the axial view, which is the top to bottom view, this is the right hand side. This is the wisdom tooth which is root canal treated. This is the left hand side. You can see that the buccal cortical plate is completely fused with the tooth on the lower left region. Now on the lower right region, you can see this is the root apex. It's very close to the inferior alveolar nerve. As the inferior alveolar nerve travels upwards along the ramus, this is the root canal, and you can see that it is slightly extruded, and a radiolucency is also associated with this tooth. So if you have any further questions regarding this case, these are the two implants which are placed as well. So if you have any further questions regarding this case, please feel free to reach to our team. Thank you very much.